Respiratory specialist Angela Evans has saved hundreds of patients from taking the wrong medication after they were misdiagnosed. Until 2006, chronic obstructive pulmonary disease was being incorrectly diagnosed across the country. But specialist respiratory practitioner Angela, who spent 29 years working at the University Hospital in North Staffordshire, was recruited by Stoke-on-Trent Primary Care Trust to tackle the issue in the city, where at least 400 out of the 800 patients were not actually suffering from the lung disease. Across the country, nurses were not trained correctly to carry out tests, and GPs did not have the expertise to interpret the results. As a result, patients were wrongly diagnosed and were prescribed medication that could have long-term effects on their health. Those misdiagnosed were suffering from other conditions, including heart disease, which were not treated. But since 55-year-old Angela was drafted into the trust 6 years ago, patients are no longer misdiagnosed, and earlier this year she received an MBE for her 36 years in the health profession. Angela from Kidsgrove was the first in Britain to bring sophisticated testing techniques out of hospital and into all 26 GP surgeries in her patch. The move also saved the NHS money because officials did not have to prescribe medication to the 60% of patients that did not need it. Mandy Donald, Managing Director of Stoke-on-Trent Community Health Services, said, "Angela is extremely well known within the respiratory field and is highly regarded by her colleagues and patients."